So now we're beginning to understand that perhaps on average, patients will do better with laser first than drops first, but it really does depend on each individual patient. And there are some patients who will clearly do better with drops first and others who will clearly do better with laser first. Factors include what is your level of pressure, the type of glaucoma you have. There are certain types of glaucoma you need to be quite cautious about having laser for, and laser might not be appropriate for your specific type of glaucoma. If the pressure is actually quite low and you're developing glaucoma with low pressure, it might be starting off with certain types of eye drops is more likely to be effective than with laser. In the future, we're going to be able to use people's genetic code to decide which treatment will work best for them. So a real pro of the laser is that once it's done and if it's successful, then you don't need to remember to put an eye drop in every day. Also, putting in an eye drop can sometimes irritate the eye, but interestingly, in a big study comparing drops to laser, people didn't find that their eyes were more irritated and their quality of life was no different, even having to try to remember to put the eye drops in. You certainly can. Laser, we've shown laser to be effective even after you've been on drops previously. Some research suggests you might get the best benefit of any treatment when it's given first off. So if you start off with laser, that will be the best response you will ever get from laser. But if you start with drops, that would be the best chance of getting a good response with drops. But certainly you can consider laser after already starting drop treatment. One common situation when we do that is if someone's developing side effects from drops or they're struggling to remember to put the drops in regularly, we can then switch to laser to see if we can replace the drops and no longer need them anymore. It does. And how long it lasts, it again depends on the individual patient. Some studies suggest that with allowing the option of a top-up laser at some point, because you can repeat the laser, 70% of people are still well controlled even at 6 years after that initial treatment. Whereas other studies which didn't require lots of selection criteria to get into the study, so just looking at all the results from clinics across the UK, suggest that on average laser lasts 2 years and then something else needs to be done at that point, which could be a repeat laser treatment. So if you're concerned about glaucoma, maybe you've been told you're at risk of glaucoma or have a family member with glaucoma, or maybe you would like a second opinion on your glaucoma that's already being cared for, then please visit our website, Clinica London, for more information and on how to book an appointment at our clinic on Harley Street in London. To book an appointment, please visit our website, clinicalondon.co.uk.